Welcome to Vaidyar.com. And joining with us today, Dr. Prathamodita Bhojan. Dr. Prathamodita is a renowned Ayurvedic physician from Kerala who practices cognitive behavioral therapy, emotional intelligence, hypnotherapy, yoga, Reiki, and stress management. Welcome, Dr. Prathamodita.
Thank you.
And our doctor is here to give you a new perspective on cognitive behavioral therapy and Ayurveda. So, what is cognitive behavioral therapy?
Cognitive Behavioral Therapy, or CBT, is a talk therapy. CBT educates us about our thoughts, about our emotions, behavior, how they are interconnected, and help us to solve our problems accordingly.
So, how exactly cognitive behavioral therapy helps?
Cognitive Behavioral Therapy, or CBT, help us to understand our cognitive errors or faulty thinking patterns and help us to identify them and challenge them and then reframe them to a much helpful manner.
So, what is this errors or that negative thinking pattern?
This cognitive error or negative thinking pattern, or we say faulty thinking pattern, I'll try to explain with an example. If we say that he should do that, that is a cognitive error. He should do that. We can't take the responsibility of a person's about a opposite person's behavior. So when we say that he should do that, he is supposed to do that, he is owed to do that, he must do that, all these are should statements. And these should statement is an example of a cognitive error. When we have such thoughts, when we have such thinking pattern, it will automatically lead to dissatisfaction, disappointment, frustration when we ourselves or the person fails to meet the unrealistic expectations.
Okay, so who are the patients and what are the conditions in which cognitive behavioral therapy is more beneficial?
Mostly it is used in depression, anxiety, bipolar disorders, eating disorders, sleep problems, OCDs, phobias, fibromyalgia, or even conditions like irritable bowel syndrome. In these, it helps to cope these symptoms in a better way.
So, how does someone knows it's time to seek the professional help?
When we feel that we are not in a position, or when others tell us that you something is wrong, when we have prolonged depression, we are not in good mood, when there is irritations or agitations, and we feel like we need an external help, then it is exact time to go for a professional help.
Okay, while talking about depression, how CBT helps with depression actually?
CBT is a time focused therapy, or it's a short term therapy. In depression, CBT helps to understand this life situation that is contributing or causing to depression and to adopt new helpful thinking pattern.
So, how cognitive behavioral therapy can be helpful in anxiety as well as the trauma related disorders?
Just like in depression, CBT here helps to improve our thinking pattern as well as our behavioral pattern and to learn more coping skills in our situations. It will help us to learn relaxation techniques. If needed, it will expose ourselves to exposure therapy in which we tackle our fears by exposing ourselves into the fear. And there are many other techniques used in CBT.
So, how is it different for children and adults?
In children, it is mostly done in collaboration with the parents. There are slight difference, of course, as there it is dealing with the cognitive part as well as behavioral part. According to the age, there will be some difference in the criteria, but mostly they are same.
Okay, so how much is the duration or the period of treatment?
Duration, we can say like once in a week. It will be like around 5 to 20 sessions. Or on an average, we can say it will be like 12 to 15 sessions.
And is there anything similar to CBT in Ayurveda?
I'll be glad to answer this. Psychotherapy is nothing new to Ayurveda. Modern roots of CBT can be traced back to ancient literature of Ayurveda. In Ayurveda, we say about Satwavajaya Chikitsa, in which intellect, courage, fortitude to be exact, and memory is brought into a normalcy. That is Di, Dhriti, and Smriti. As per Ayurveda, the Dhairya Atmadi Vijnanam is considered to be the Param Aushadha of Manas. That is the important and most important medicine for mind is our intellect, our courage, as well as Atmadi Vijnanam. Atmadi Vijnanam means personal orientation or self-knowledge or self-awareness, or along with self-awareness, we require time orientation as well as place orientation. And that is a wide concept, and all these are dealt in detail in Ayurveda.
So, while following the methodology of Ayurveda, how does it help exactly?
Methods like controlling mind by focusing on the subjects of mind, like Chintyam, Vicharyam, Uhyam, Dehyam, Sankalpam. Chintyam is regulating our thought process. Vicharyam is regulating our ideas. And Uhyam by channeling our assumption or guessworks. Vidheyam, in which we consider or focus on the objectives, and then Sankalpa comes, that is our decision making. By following these, it helps us to discriminate between the thought as well as our actions, discriminate between objectives as well as assumed threats, and thus help us to respond in a situation accordingly. It will help us to face our fears by understanding the or having a proper awareness regarding the matter and its true facts.
So, are there any Ayurvedic formulations that can be used in the treatment period?
It would be an added advantage if you are using Ayurvedic medicines along the treatment. There are many formulations like Kalyana Kritam, Kalyana Kashayam, Mansamitrati Vadakam, or Sarsada Churnam, or Sarsadarisham, and there are many lists. And there are many herbs which either act as a neuro, like brain tonic in nature, which acts as a sedative in nature, which act as a calming in nature. So according to the condition, we can choose these medicines, and if needed, can be used along with the treatment.
So, how can the patient and the respective family knows it's getting better or the treatment is working?
Of course, by measuring the outcome, by measuring the symptoms, occurrence of these symptoms, and about their frequency, it will help us to understand about the efficiency of the treatment. We can evaluate by the symptoms, like before the session and after the sessions. The person will understand how effective the treatment is.
So, how can cognitive behavioral therapy and Ayurveda can be combined and followed in the daily life as a preventive care, maybe?
There is no fundamental difference between the principles of CBT as well as Satwavajaya. It would be a wonderful thing to if you adopt both, like both Ayurvedic principle as well as CBT. It will be a wonderful result, and results would be amazing for sure. If you try to follow Ayurvedic rules like Dinacharya, the daily regimes, or Achara Rasayana, the behavioral therapy mentioned in Ayurveda, or Sadvrita, the code of conduct mentioned in Ayurveda, along with CBT approach, would definitely prove to be a wonderful way of living.
That was very informative. Thank you so much for the time and commitment for doing this interview for Vaidyar.com, Doctor. Thank you.
Thank you.
And this is Vaidyar.com. Please keep watching our channel, comment, and do subscribe. Please stay safe, stay healthy. Thank you.